My name is Kristina Marie Andaya. You can call me Tin. And I am delighted to be here with you today, my dear nurses. Okay, so great day, good morning, good afternoon, good evening. So today our topic is all about our measuring and flex prioritization. Okay, so all right, nurses, here's our game plan tonight. Okay, so our goal is very simple. Okay, to master the prioritization frameworks that will help pass the NCLEX RN in just 85 questions. Are you ready? Are you ready, my dear nurses? Yes. Because when you understand what to do first, fast and safely, you gain control of the entire test, right? So, what are we covering? The most powerful prioritization principle. Okay, so we'll tackle sample and collect self questions together and help you sharpen your clinical judgment skill as well. So, which is exactly what the next version NCLEX is all about, right? So, by the end of this session, you'll be thinking, choosing, and answering like a USRN, like a pro. Are you ready, guys? Okay, fine. Okay, so hi guys. Okay, ayan. My dear students. Okay. So why the prioritization matters? Okay, so let me start with this. 60 to 70% of the NCLEX is not about the medication, diseases, or lab values. It's about safety and prioritization. And if you don't understand prioritization, you will not pass. That's the reality. Even if you know every medication by heart, huh? Am I correct? Okay. So because here's the truth. Okay, so you're not just picking the right answer, you're being tested on how you think like a real nurse. Okay, so it's like a real life or a real life scenario, right? And when the clock is ticking and lives are on the line, the NCLEX isn't asking you who is sick, is asking who's going to die first if I don't act. Okay, who's going to die first if I don't act. So okay, it's all about prioritization. And if you can answer that every time, yes, there's a high probability that you will pass the NCLEX. Yes, in 85 questions. So let's break it down. I'm going to give you because this is just an hour. Okay, so I prepared a 12 rock solid prioritization rules that will turn you into a clinical ninja. Okay, are you ready? Okay, hello, Miss Zina. Okay, yan. Okay, so it will turn you like a clinical ninja, ready for any scenario. Okay, the NCLEX throws your way. Okay, so let's go, my dear nurses. But before we start, can we please type yes if you are ready? So we are 66. Okay, mahabol pa yung iba. How about the others? Are you ready? Yes, mastering your prioritization first. Okay, so we have here the first principle, rule, or parameter that we're going to use. So we have here what we call, okay, this one is, very easy. You already know this, but cannot afford to miss this. Okay, the unstable versus the stable. Okay, so let's start with one of the most important prioritization rule. You cannot afford to miss this. Unstable versus stable. Okay, so when the NCLEX gives you four patients, ask yourself, who is unstable? All right, because asking for the priority. Okay, you will ask yourself, who is unstable? But before we proceed, who is unstable? It's very important is that you know and you understand, okay, clearly what is unstable means. Okay, what does unstable mean? Okay, so meaning there's a life threatening condition. Okay, so the condition is life threatening. What else? There is a problem or there's a problem in ABC or ABC issues or airway, breathing, and circulation. What else? There's an abnormal vital sign. All right. So another technique is that there is a new admission. Okay, new admission. Okay, patients. Okay, newly admitted patients are unstable. That's the keyword. That's the favorite of your NCLEX. Now, key word, my dear nurses. My dear nurses. Okay. What else? Unstable. Okay. We will include acute or worsening symptoms. If there's, a worsening of the condition of the patient, of course, okay, it's very, very important to report it immediately to the HSP because it requires, okay, the highest prioritization. Next, we have here what they call your stable. So for the stable, we have here the condition of your patient is under control. The vital signs are within the normal range. What else? Of course, the outcome is expected. You don't need to report it to the HSP. Okay, if the outcome is expected, just document it. All right. So meaning that's not our priority this time, right? So patients are recovering, or another keyword, okay, the schedule for a certain procedure. Yes or no? Yes. All right. So and quick tip: if a patient is newly admitted and has abnormal vital signs, that's a red flag, my dear nurses. Every time, single time, my dear nurses. Yeah. Right. So I prepared a very simple uh a quick style question. Okay, yeah. So we have here the nurse is prioritizing care for 4 patients. Which patient should the nurse see first? Okay, so we have here options. Okay, so I will give you like 15 seconds. Okay, so read the question 2 to 3 times. So that be in a hurry. Okay, look for the keywords. Use the power of elimination for you to come up, okay, on a correct answer. Okay, so I will give you 15 to 20 seconds. And if you are done, kindly key in your answer here in our chat box. Okay, wag kang mahiya. So not be shy ha. It's okay. Okay, ayan. So just participate. Okay. So I will wait for your answer, my dear nurses. Yeah. Okay. Yes, you can do it. You can do it. Okay, very good. Oh, what's your answer? What's your answer, my dear nurses? Oh, what is the answer here? What is the answer here? The correct answer is. Oh, it's very obvious. Look for the keyword. What is the keyword here? Then is it letter A? Okay, the correct answer here is letter A. Very good, no? Very good, Jill. A newly admitted patient with chest pain and a blood pressure of 90 over 50. Okay, so what is the keyword here? Uy, newly admitted, diba? Okay, so based on our parameters a while ago for unstable versus stable, okay, the term newly admitted because this patient haven't received any treatment. Okay, so may yes, newly admitted, they are unstable. They have most of the time they have unstable vital signs. So this is our priority. That is why, okay, the nurse should keep first this patient. Correct answer, it's the letter A. We all are hypotension. Hypotension. And there's a chest pain. Yes or no? Yes, it requires, okay, high priority system. One sec, my dear nurses. Let me just, okay, ayan. Put a highlight here. Okay? So again, letter A is the answer. So why? So this patient is unstable. Aside from that, aside from the keyword, it's very, very important that you know how to recognize the cues. All right? So the indication, okay, the chest pain and having a low blood pressure could indicate what condition, what disorder. What disorder, my dear nurses? Okay, I'm checking, okay, the chat box. I'm checking the chat box. Uh, okay, I'm checking the chat box, the Facebook chat box. We have here Marge. Hello, Lizelle. Okay, so what's the rationale? Okay, this is the indication that the patient might having what? Okay, myocardial infarction or stroke. Yes or no? Yes. Okay, so other patients, other options are stable. They can wait without immediate risk. Okay, very good. So just like think of it like a hospital triage. If one patient is bleeding or can't breathe, okay, you run to them first. Okay. Okay, so if someone just needs stitching, okay, or help to the bathroom, they can wait. Okay, they can wait, huh? Okay, bleeding, can't breathe. Okay, you need to prioritize that. Okay. All right. Okay. Another parameter we have here your acute versus chronic. That's a key takeaway, huh? Okay. Another one is your acute versus chronic. What is this? What is this, my dear nurses? When we talk about the acute versus chronic, of course, what is your priority here. Okay, so when prioritizing care, you will check for what is this patient experiencing acute or chronic problem. Okay, so acute means what? Okay, the condition is sudden. Okay, what else? New and possibly life threatening. Okay, for chronic, it means it's long term and it's expected, progressive, and usually under control. Okay, take note of that, my dear nurses. So here's the shortcut to remember: chronic patients can wait. Okay, acute patients can't. All right. So I also prepared okay an NCLEX style question here for your acute versus chronic. Okay, I'm checking the chat box again. Okay, so you're the nurse on duty and you get this list of patients. Who do you see first? Okay, so we have here options. All right, so I will give you 15 to 20 seconds. Okay, to read the question, the ratio. Kausapin mo sarili mo, guys. Okay? Alright? Use the power of elimination. Do not be in a hurry. Look for the keywords. Alright? Okay. Yeah. Just take your time to answer. If you already have your answer, kindly key in okay your answer here in our chat box. Okay? What is your answer here? The correct answer is oh, who do you see first? Asking for the priority scenario or condition. Okay? Right? Oh, Stephen says C. Hello, Stephen. Cat says C. How about the others? Okay. Correct answer is very easy. Okay, the correct answer is letter C. A patient with new onset confusion and a fever of 102 degrees Fahrenheit. No? So aside from that, okay, like this one, your diabetes condition is, a chronic, okay, a chronic metabolic disorder, right? Letter B is COPD, chronic obstructive pulmonary disease. Letter D, hypertension. Okay, so compared to letter D, my dear nurses, there is a new onset confusion. Okay, it's acute and could indicate a serious infection or even sepsis. Okay, all right. So the patient is unstable. Okay, the others, okay, again, they are all chronic and expected. Okay, the manifestations are expected in condition. All right. Again, don't get tricked by numbers just because 180 looks high, right? Doesn't mean it's priority and like is very very overwhelming, bit tricky. Yes, nakakalito yan, but very very important is that what are the expected on a certain condition. Yes or no? Yes. Okay. So that's the second parameter, your acute versus chronic. Okay. Next, we have here the unexpected versus expected. Okay. So this next principle is favorite on the NCLEX. All right. And it's a trap for a lot of test takers. Again, okay, this is the favorite of your NCLEX app. It's a trap for a lot of test takers. Okay. Sometimes students, are, in a hurry. They're always in a hurry when answering. Again, you will be given 5 hours to answer the exam. Do not be in a replay. Okay, read the question carefully. Look for the keywords. You will be given a board. It's like a graphing paper that is laminated and you will be given a permanent marker. Utilize the board. Okay. Magrasyo ka dyan. Yes, the power of elimination is very, very important for you to come up, okay, on, of course, the best answer. Right? So this question is not just, is it abnormal? Okay, it's, is this expected for the condition or is this something new or dangerous? Okay, so when we talk about the expected, okay, you observe, you document, you follow up. Okay, for unexpected, you need to act now because that's your priority. Okay, so when we talk about if you're expected when it comes to the medication, okay, that's side effects, all right, or the primary or the intended effect. But if there's worsening of the condition, wait, that's red flag. Okay. You need to report it because, okay, it requires the highest prioritization. Same as on a certain disorders, when it comes to the clinical manifestations or um the signs and symptoms, okay, basically is that's expected. Okay. So again, if there's a worsening of the condition, like for example, complication, toxicity, adverse effect, adverse reaction, that's reportable. Okay, so that's unexpected. Okay, that requires okay the highest priority. Okay, again, anything new onset, worsening, or complication, that's a red flag. And as registered nurse, you must have a solid understanding of these disorders. Uy, it's already a complication. Okay? You should know how to recognize the cues, especially if it's already a crisis, right? Okay, very good. So I prepared an sample question here, and let's answer. So which finding needs to be reported immediately? Okay, so we have here four scenarios again. I will give you time to think to answer carefully. All right? Okay. So again, do not be in a hurry, ah. Perting kita. Okay, sige. Do not be in a hurry. Again, read the question 2 to 3 times. Look for the keyword. Use the power of elimination. Okay. And if you're already done, kindly key in your answer here in our chat box here in our Facebook Live. Okay. All right. So we have here four options. First is post-op patients with mild pain at the incision site. All right. So letter B, diabetic with a fasting glucose of 130 milligram per deciliter. Letter C, chemotherapy patient with a platelet count of 50,000. And letter D, pneumonia patient who suddenly develops tachypnea and hypotension. What is your answer? My dear future USRL, Uy, Mom Tin is kind of tricky. I'm confused between. Okay, what's your answer? What's your answer? Okay, the correct answer here is letter D. Oh, very good. Okay. Oh, you can pass the NCLEX. Oh, Ana. You can pass the NCLEX na. Okay, correct answer is letter D because, okay, pneumonia patient who suddenly develops tachypnea and hypotension. Hypotension, this one is unexpected. So meaning, okay, wait, there's already a worsening of the condition. So meaning this is not normal. This is reportable. Something you need to report. Something you need to prioritize, right? Okay. Again, it's not expected for pneumonia. Okay, and could mean what? Okay, and could mean, oh, all right. All right, sepsis or respiratory failure. The other three, okay, they are all expected, explainable, and safe to monitor. Yes or no? Yes, very good, my dear future yes RN. Very good. Okay, so next parameter, we have here your nursing process. Okay, we have your assessment versus implementation. Okay, so let's talk about a golden NCLEX rule that many test takers forget. Okay, so always assess first. Okay, can you still remember your ad buy? So meaning then, okay, if it's non-urgent, okay, of course we'll stick to okay in the right sequence. It should be ad buy, assessment, diagnosis, diba? Nursing diagnosis, planning, implementation, and evaluation, right? And as a registered nurse, you must have a solid understanding, okay, about this assessment, no? Because in the actual NCLEX, okay, most of the time will not mention for the diagnosis of your patient. Rather, okay, especially when it comes to the case study, okay, there's a stiff complaint, all right, and of course other supporting manifestations plus the laboratories, okay. So there's no specific diagnosis, all right, diba? Most of the time, and asking you for your priority interventions, for your priority teaching, something like that, right? So meaning you must have a solid understanding, especially when it comes to what recognizing the cues and then the plastic sign or the pathognomonic sign. That's the favorite of your NCLEX. Okay, you cannot afford to miss that, right? Assessment, Mom Timmy, yes or no? Yes, right? So always assess first unless you're in an actual emergency, like for example, cardiac arrest or if there is an airway obstruction. Okay, so if the question gives you a choice, between gathering data versus taking action. Okay, and the patient is not actively dying, you assess first. Okay, so that's the rule of thumb now. And what else? Why? Because you need to complete data before making the right decision. Acting without assessing could make things worse. Yes or no? Yes. Okay. So the second concept here, okay, also is very, very important to what? Always prioritize actual problems, okay, over the potential risk. Again, what is your priority? Okay, the current scenario, okay, the actual or um something that is happening right now. Okay, over what the risk, the potential. Okay, if someone is dizzy right now, that's an actual problem. Okay, if someone might fall later, then okay, is that just a potential risk? Okay, so it's very, very important to what? Fix what's happening before, okay? Before planning ahead. Okay, again, fix what's happening first, okay, before planning ahead. Okay? Again, prioritize the actual problem over the risk and then the potential. Okay. So I prepared here an actual NVN question. NVN or NCLEX question. And a nurse receives a report on 4 patients. Which action is the priority? Which action is the priority? Yeah. I'll just wait for your answer. If you're done, kindly key in your answer here in our Facebook chat box, right? Are you done? Okay, so we have your options: administer pain meds to a patient reporting 7/10 pain, teach a diabetic patient about food care, right? Check vitals on a patient who reports dizziness, prepare a patient for discharge. So this one is very, very obvious. Nah, the correct answer here is very good, Stephen. Is your letter C. Uy, what is the keyword? The report of what? Dizziness. Because yes, the manifestation or recognizing the cues, dizziness could mean what? Dizziness could mean it's very, very important that you know how to recognize cues. Uy, that's your clinical judgment. Okay? Okay. I'm always telling this to my students, no, especially for you all nurses, no, for getting ready for your upcoming NCLEX hard examination, for you to pass your NCLEX case. So it must be two things. Okay, first, okay, I will reveal the secret ha. Uy. Okay, ha? Okay, especially you guys 59 kayo, nakakaalam ng sikreto, okay? For you to pass the NCLEX, especially if you're aiming, okay, to stop with flying colors, okay, so meaning it's 85. Okay, first, you must have a solid mastery or understanding, okay, of the nursing concepts, okay? Okay, that is pattern, okay, in our NCLEX. So basically, it's very, very important to review the framework, all right? Okay, so that will be discussed on your next generation NCLEX, the framework. What are the categories, the core categories? Okay, so the pattern, something like that. Okay, so very, very important. You must have, again, a solid mastery of the nursing concept. It must be a solid mastery. Okay, you don't need to memorize, but okay, don't worry. We will reveal, okay, okay, the technique now when you enroll in IPASS. Okay, of course, we are here, your coach, your mentors to help you, my dear future USRN. And second one, kumapit ka. Okay, my dear future USRN. Okay, having a solid mastery or understanding of the nursing concept is not enough. Okay? What is the second one, or for me, the second element for you to pass? Okay, with flying colors. Second one is you must have a solid mastery of the test taking strategy. It's a different thing. It's a skill. All right? There are some, students who are gifted. It's a God given talent. But good news. All right? If you are not good in test taking strategy, okay, way back, especially high school days, college, especially when you're studying before, no, nag-aaral ka pa, no. But good news, okay, that skill can be developed. Okay, again, that skill can be developed po. Okay, and we will help you, okay, to achieve that, okay, diba? Mastering the test taking strategy na yan. Okay, to ace the test taking strategy because for you to pass again the NCLEX, it must be two things. There are some students who are good in the concept but failed the NCLEX because of lack of this test taking strategy. That testing strategy requires your clinical judgment. Okay, and it will help you to enhance that. Okay, ayan. So actually, it's a 4-hour session. Okay, uy, apat na oras pala yun, guys. Yes or no? Yes. Kaya palang i-enhance? Yes. We are here to help you po. Okay? It's very, very important. You know yourself, you analyze yourself. These are your weaknesses, right? And if there are some students, who are not that good or just, hindi naman ganun nag-review, no? Pero they ace the NCLEX in 85 questions because, okay, they focus on this mastering your test-taking strategy. Diba? Okay. All right. So, kayang-kaya yan. Okay? Again, it must be a combination of that. Okay, two elements, no, para pumasa. All right? What is your answers here? Answer is your letter C, ha? Okay, again, it could mean, okay, dizziness could mean hypotension, hypoglycemia, or something serious. Okay? Dizziness, keyword. Okay, there's something wrong. Okay, so it's very, very important you assess first before giving any medication or any health teaching. Add by assessment first. It should be in the correct sequence. All right. Okay, before we continue, my dear nurses, can you please type yes, yes, yes? Okay, if you are gods. All right, if you can understand what I am saying, diba? Kung ano gusto ay parating ni Ma'am Tien, makuha mo na yan. Makuha mo na yan, diba? Lisensya mo na yan, this 2025, ilaban mo. Alright. Next parameter, we have here your emergent versus non-emergent. Okay? Alright. So now let's talk about a prioritization principle that literally saved lives. Take note of this one, and that's knowing how to spot an emergency. My dear nurses, this is the favorite of your NCLEX, ha? Again, 60 to 70% or 70 to 80%, okay, prioritization ang laman ng NCLEX mo. Okay, so when the question gives you multiple patient scenario, it's very, very important to what? Ask yourself, okay, is anyone experiencing an airway, breathing, or circulation problem? Same as your unstable versus stable. Diba? Almost the same. All right? Okay, very good. Okay, again, is anyone experiencing ABC problem? And if yes, that's your priority. Why? Because they can crash at any second. Use your ABC. So meaning, team, we will expect questions, okay, na talagang maraming when it comes to the ABC. Yes, and when you are preparing for your upcoming NCLEX or an examination, it's very, very important that you understand, these are the favorite of NCLEX, the parameter, okay, the most of the question, okay, will focus on the ABC most of the time, yes. Because that's the first parameter that we're going to use. Like, for example, on the unstable versus stable, there's, okay, your ABC. So meaning airway and breathing, okay, is that your respiratory system? Yes or no? Okay, so you will expect questions. Okay, more questions. Okay, about your respiratory system, the disorders, the medication, the nursing procedures. Yes or no? Suctioning, tracheostomy, something like that. Okay, because it's your airway and breathing. So how about then? Okay, your letter C. All right, your circulation. Okay, that's your cardiovascular. Okay, cardiovascular. So meaning we will expect question about cardio. Yes or no? That's the favorite of her NCLEX because it has something to do with perfusion. Yes or no? Yes. You will expect question. For example, your heart failure. You cannot afford to miss the medication. That's the favorite of your NCLEX. It's a promise, my dear nurses. No, you should know how to recognize the signs when it comes to giving medication. No, if there's if this patient is having a toxicity already, okay, NCLEX will ask you, okay, what should be at the bedside, something like that, and you should know how to recognize na, okay, if there's an additional worsening of the condition, okay, this patient is taking, for example, digoxin, And the RR is always 7 RR. Oh my God. Ano ba? Okay. RR7, ano pa? Okay. Hindi lang, no? Because digoxin, no? Okay. Uy, heart rate. What is the heart rate? Baka 45. Withhold, no? Withhold mo na yan. No? Kaya today, withhold mo na yan. So it's very, very important that you know how to recognize. Okay, maybe that patient is having hypokalemia already, right? There's a problem when it comes to the site. That's in having hair loss, GI upset, anything that is something to do with the GI upset, something like that, no? Okay, uy, ha? Very, very important. You know how to recognize the cues, right? A, B, C. So many we will expect to learn more about our respiratory system, cardiovascular. Yeah, you cannot afford to miss that. Okay? If your patient, for example, when it comes to recognizing cues, there's a respirator. Okay, what else? Anaphylaxis or anaphylactic reaction. Uy, what else? Severe shortness of breath. There's an uncontrolled bleeding. Okay, okay. The keywords or the phrases, okay, that I've mentioned, okay, the Sidor anaphylaxis. Uy, that's the favorite of your NCLEX. Ha? Kinakaya mo, Christine. Kaya today. Kaya today, yes. Right? So, meaning, will expect talaga question, okay, like bleeding, yes. Favorite niyan, ha? So, meaning, Ma'am Tin, I know now, okay, uh, what to review, yes or no? Yes, okay. So, we have here, okay, question, ano? All right. Okay, so let's answer this question. All right. So let's answer this question, my dear nurses. Which patients should the nurse assess first? Okay. So again, what is the technique? Use the power of elimination. Do not be in a hurry. You'll be given 5 hours to answer the exam. Okay. Look for the keywords again. Okay. Ika. 20 seconds. If you're already done, kindly key in your answers here in our chat box. Right? So which patient should the nurse assess first? Letter A, a patient with severe difficulty speaking. B, a patient complaining of intermittent abdominal pain. C, a patient requesting discharge testing. D, a patient needing help to the restroom. Okay, so what is the answer here? Stefan says A. How about the others? Uy, there's a keyword already. Uy, anything that reflects airway, any compromise in the airway, in the throat. All right. Okay. Very good. The correct answer is letter A. A patient with severe and difficulty speaking. That reflects, okay, very, very obvious airway emergency. Okay, like for example, the keyword is severe. Okay, so meaning if there's an upper airway obstruction, very good, Christine. There's a laryngospasm. So it's very, very important, okay, having an obstruction or laryngospasm. Okay, act now because the patient may stop breathing. Yes or no? Yes, okay. All right. Again, just remember the ABC. ABC is not just a framework, huh? It's a survival checklist, my dear future yes or again, if the patient can't breathe, okay, again, if the patient cannot breathe, they cannot wait. So meaning that's your priority. Okay? So if they're just asking for testing, for pain medication, or the bathroom break, no, okay, they can leave ha compared to the option here. Okay, letter A. Letter A is the correct answer. Okay. Wait, I'm so sorry. I forgot to highlight the correct answers. Okay, just okay. Go back to the recording. Oh, go back to the recording session. Okay. Next, another parameter is rapid deterioration versus the gradual decline. So it's very very important if I'm I mentioned a certain parameter that okay that you understand this parameter ha. Okay. Okay, so it's very, very important to what ask yourself: is this a sudden change or a slow one? Okay, so if it's rapid deterioration, okay, so meaning is that's a danger. Take note of this one, ha. If there's a rapid deterioration, meaning that's a danger. Okay, red flag already. Okay, so what are the common keywords that you might encounter on your upcoming NCLEX or an examination? The confusion. Okay, there's a sudden confusion. Okay, what else? A new drop in oxygen saturation. Okay, you will look for those keywords, ha? Especially when you are answering next generation NCLEX case studies. Don't worry, we will have a separate discussion of that one because we're just 1 hour lang. Okay, we will focus on answering case study separate po yan. Okay? Ayan. Confusion, sudden shortness of breath, drop in the O2 stat. Okay? So, when you're answering a particular case study, look for this vital signs po. The vital signs, look for these laboratories. Okay, ayan. Okay, so what else? Okay, that's a 911 moment na on the NCLEX, okay? But if it's a gradual decline, like worsening fatigue or slight weight loss, okay, over a week, you can monitor it. Okay, so meaning it's not rush compared to, okay, the rapid signs. There's a rapid deterioration. Okay, so meaning that's a danger. These are the favorite keywords of your NCLEX. You cannot afford to miss this, my dear future USRN. All right, so let's answer this. Okay, so which patient should the nurse assess first? All right. Okay, so for those nurses who just enter our Facebook Live, okay, great day po. Great day. Ayan. So our topic for today is all about your mastering NCLEX prioritization. Okay, so what is your answer here? Okay, what is your answer here? My dear future USRN Taya today. All right, what is your answer? Answer is letter C. Very good, no? Okay, letter C. Okay. Why? A pneumonia patient with new onset autosat of 88. Okay, so it's very, very important before we come up to a specific answer. It's very important that you know, okay, what is the normal? Okay, what is the normal autosat? What is the normal autosat? It's 95 to 100%, right? And for COPD patients, all right, for example, patients with emphysema, chronic bronchitis, they can tolerate autosat of 90%, okay, and above, right? So that's expected. You don't need to report it to the HSP if the condition of the patient is COPD, but this time it's pneumonia. It's pneumonia, okay? And there's a new onset. The autostat is 88, okay? Ayan. So meaning that's abnormal, okay? And that's a rapid hypoxia, okay? It can escalate fast, right? So that's who you go to first. So meaning this is our priority, okay? The other options, okay, there's, a gradual issues, okay? Ayan. You cannot ignore the other issues or the other options, but okay, it's not the priority this time compared to letters. Okay, very good. All right. Okay, very good. Okay, next parameter we have here your acute versus chronic pain. Again, your acute versus chronic pain. So when we talk about of your acute, what does it mean? Acute pain can mean something dangerous. Again, acute pain can mean something dangerous. It might be what? It might be a surgical complication. Like example, there can be an internal bleeding. Actually, there's a lot of condition associated with acute pain, right? Or even myocardial infarction, my dear future USRNs. Okay. So another term for your myocardial infarction, your heart attack, or your acute coronary syndrome. Okay. So then, what is the favorite of NCLEX? Is it MI or ACS? Both. Okay. They both use ACS or MI. Okay. So for chronic pain, okay, that's managed over time, my dear future USRN. Okay, so it's uncomfortable. Yes, but it's not life threatening right now compared to your acute pain. Okay, so meaning in prioritization, you go to the pain that is what? That is new. Okay, what else? Severe and unexpected. Okay, so not the one that's been there for years. Okay, so meaning It's your acute pain. Example, okay, so let's answer this. Which patient should the nurse see first? Okay, mumpkin, more prioritization. Yes, we can do this. Okay, right? So take time to analyze, read the question 2 to 3 times, read the options carefully, use the power of elimination, do not be in a hurry. Okay, yeah. Okay, what is your answer here, my dear future SRS? I'm checking the chat box in our Facebook. Okay, kindly see your answers. Right, the correct answer is C. How about the others? Mm-hmm. MJ is A, Rochelle A, Kat C, right? Mary A. All right, the correct answer here is letter A. Because what? Okay, because severe acute post of pain could signal what? Could could signal hemorrhage, infection, or dehiscence. So it's very important. Okay, you assess that immediately. My future SRN. Rest of the options are chronic pain. Okay, yes, real but not emergent. Okay. All right. Wait, it's letter A. It's letter A, not letter C. Yeah, letter A po. Letter A. Correct answer here. It's letter A. Okay. Next. Okay. So we also have here your unknown versus known diagnosis. All right. So it's very important to what always prioritize the client with with what the unknown diagnosis over the one with a known or stable condition. Okay, right? So why? Because when we don't know what's going on, that's where the danger is hiding. So meaning your priority is unknown. All right. So NCLEX loves to give you a stable diabetic next to a febrile confused client with no clear diagnosis. Okay. So your instinct go to the mystery. Okay. So the client with the unknown problem may be silently heading towards a crisis already, like a sepsis, what else? Stroke or meningitis. Okay. So we have here a sample NCLEX question. All right. So which client should the nurse see first? Okay, so look at the options, right? If you already have your answer, kindly key in your answer here in our Facebook chat box. Stephen, what's your answer? Hi, Stephen. Okay. What's your answer here? What is your answer? What is your answer? Mm-hmm. What is your answer? Look for the keyword. Most of the time, if you encountered keyword like, "Uy, there's a new onset, diba? Additional worsening of the condition, very good. The correct answer here is very good. Letter C. Letter C. Uy, letter A. Letter A is expected for a diabetic patient po. All right. Letter C, a client with a fever and a new onset confusion. That's the correct answer. It's letter C po. This is our priority. That is why the nurse should prioritize this. Okay. The nurse should see first this condition. Okay, because this is a case of unknown diagnosis with a potential what? Okay, with there's a fever, there might be a potential sepsis. There's a fever plus altered mental status. Uy, meaning, uy, red flag. Yes or no? Yes, red flag yan. Uy, right? Very good, my dear future USRN. All right, it's already 8:53. Okay, so we still have. Okay, I think there's a lot of prioritization, but okay, it's very important, no? Mm-hmm. All right. Um, okay, so let's bring it all home. You've learned a lot of prioritization principles, and I want you to remember, my future USRN, the simple strategy every time you face a tricky and flex question. Because again, 60 to 70 or 70 to 80% of your NCLEX, yes, will focus on health teaching, prioritization, something like that. No, so it's very important to use this framework. Okay, again, do not just guess. or go with shortcut, diba? Or like mini, mini mo, alright? Do not guess, ha? Use the power of elimination, okay? Based on research, it's very, very important, okay, to have this recorded session, okay, to repeat it 2 to 3 times for you to have retention, okay? Again, where you're not unsure, okay? If you're not unsure, look for the answer that matches this list. Okay, if you don't know what to answer, wait, this is the key takeaways, all right? Okay, if you are not sure what to answer, okay, so look for unstable, look for acute, look for unexpected, look for the actual or the current, what's happening right now. So this four are your red flags, all right? So these are the clients who cannot wait, all right? Again, if you don't know what to answer, okay, remember what I have mentioned earlier. So I've also included this power tips. Actually, it's a 4 hour session for the power tips, but I will give you some takeaways now. Before we wrap up this, let me drop a few power tips now that can make or break your test day performance, even if you already know your content. No? So this are quick wins po, and they work po talaga. First power tip is your 60-30-10 time breakdown for a question, So spend 60% of your time understanding the steps. All right. So 30% what? Eliminating wrong choices and 10% comparing the last two options. Okay, you cannot afford to miss this power tip, ha. Again, 60% of your time, okay, understanding the stem, 30% eliminating the wrong choices, and 10% comparing the last two options. Again, do not rush to the answers. The stem is where the clue is hiding. Okay, don't worry. We will dive deep, okay, in this topic. We have a separate discussion of this one, okay, when you enrolled here in IPASS. And the power tip number 2 is to what? Read the stem twice. Again, you'll be given 5 hours to answer the NCLEX exam. Do not be in a hurry. Okay, of course, you don't want to answer up until 150 questions. So it's very, very important that you are prepared. Okay, know the proper pacing. We will teach you, okay, how to lower your anxiety. All right? Okay. Very, very important. Yan. So many people fail because they misread what the question is really asking. Okay? Read it once to understand and then read it again to catch the keyword like what? First, the priority, the immediate action, the most concerning. Write it down on your board. Again, don't be hurry, Okay, ha. Do not be lazy to write. Okay, Next, okay. Next power tip. The eliminate two. Okay, the eliminate two. Okay, so every question has at least two wrong answers. Okay, again, NCLEX will not, say or tell you this. Okay, every question has at least two wrong answers. Get rid of those immediately. So I'm always, repeating this, no, to my students. Alam mo yan, diba? Do not be in a hurry. Use the power of elimination before you arrive on a specific answer. Okay, before you arrive on your final answer, no? Then put the last two side by side and ask yourself, who's sicker? Okay? And what will kill my patient first? Yes or no? Yes. O, kung sino mamamatay? Yes. Okay? Next, all right? So the power tip number 4 dash, okay, practice cue recognition. Okay? Again, practice cue recognition. This is your secret weapon, my dear future USRN. Train your brain to spot the red flags. And how to spot the red flags? Repetition of mastering your NCLEX prioritization. Okay? So like the new confusion, low BP, diba? Okay, the O2 saturation drops, there's a sustained, there's an uncontrolled bleeding, and that keywords are favorite of your NCLEX. Actually, guys, inuulit-ulit. Ulit lang yan, ha? Okay, so it's very, very important. I'm always keep on telling this to my students, recognizing those cues, okay, is equals to what? Picking the right answer 10 times faster. All right? Okay. So meaning closer, you can say, my dear nurses, it's very important that you prioritize on the safety of your patient. Okay. You need to prioritize the most life-threatening situation. Sa madaling salita, guys, kung sino yung mamamatay na or po pwedeng, di ba? Makapaglagay sa yes, right? So this are just, a sneak peek. Okay. Uy, okay, it's already 9 p.m. na, no? Okay, 1 minute. Okay, so this is just, a sneak peek. Okay, so in our full session, we will go deeper into next generation NCLEX style question, the decision tree, and the exact, techniques, no? Because most of the patterns that I have encountered and based on the feedback of my IPASS student, no? Okay, uh, mo- this is the favorite pattern, okay? Of course, we will dive deep, okay, on those patterns by dear future USRS, no, to ace that and collect na, no? Okay, so that you can get, okay, that 85 questions na. Okay? Alright? Okay. Maraming maraming salamat po again, my future RS. Thank you so much for joining us